Thank you for joining me today. In this video, you will learn Thorazine. Thorazine is an antipsychotic medication. It's the first generation atypical antipsychotic medication. It treats schizophrenia and it also treats manic episodes, acute manic episodes. It has also non-psychiatric treatment. And it has and the other name is ChlorproMAZINE, and it has a low-potency phenothiazine. Also, is classified as an antiemetic and sedative. So it has a low-potency, more anticholinergic, sedation and hypotonic effect, and less EBS compared to other psychiatric medications. Mechanism of action of Thorazine is it blocks dopamine at the D2 receptor and primarily antipsychotic effect that causes antipsychotic effect. Additional receptors that Thorazine blocks include α₁-adrenergic, and that causes orthostatic blood pressure, orthostatic hypotension, and it also blocks M2 muscarinic receptor that leads to anticholinergic effect. It also blocks H1 histamine that leads to sedation and weight gain. It also has mild serotonin receptor blocker. This medication is FDA approved for psychiatric such as schizophrenia, other psychosis disorders, acute manic episodes. It has also non-psychiatric treatment such as it treats severe nausea and vomiting. It also treats intractabular hiccups. It also used pre-operational anxiety and sedation. It also additive in tetanus, and it's also treat acute intermittent porphyria and severe behavior problems in children can be used short term only. It has a black box warning, and it increases mortality in older adults with dementia and related psychosis, and not approved for this group. Okay. Thorazine has dose related. You will begin 25 and then you will titrate slowly to 25 orally 2 times a day or 3 times a day for adults with psychosis and schizophrenia. It also has acute agitation benefit and has a low-potency dose limited by side effects. It has also limited side effects of EBS. Adverse effects for this medication include sedation, hypostatic blood pressure, anticholinergic effects such as dry mouth, constipation, blurry vision, urine retention. It has a less EBA symptoms, as we mentioned before. However, it has a serious side effects of neuroleptic malignancy syndrome, QT-prolonging, cholestatic jaundice, it causes jaundice, photosensitivity, cornea and lenses deposit, and it also causes anti-glucocytosis. It's contraindicated for dementia-related psychosis, severe central nervous system depression. You will be cautioned with the patient with cardiovascular disease, caution with the patient who has glaucoma or BPH, patient who has a hepatic disease, patient with seizure disorder, older adults. It can increase fall and lowers the blood pressure for older adults. So be cautious with that. You want to monitor the vital signs. You want to monitor blood pressure. You want to monitor the heart. You want to assess using EKG. You want to monitor the risk of QT-prolonging, and you don't want to prescribe other medication that also has a QT-prolonging. You want to also assess left FT for cholestatic hypotic risks. It increases the high liver inflammation. Also, you want to assess EBS and TDS muscle movements. You want to also assess the heat intolerance and hydration. It has a drug-to-drug interaction, and it has a drug-to-drug interaction with TCA, that's antidepressant medication, and antihistamine medication. It increases hypotension with if you prescribe with anti-hypertension medication, it will lower the blood pressure, because hypertension medication will lower the blood pressure and this will lower the blood pressure, so that will cause more low blood pressure, hypotension. It also depresses central nervous system, and it will increase with the alcohol and benzodiazepine. So you don't want to prescribe with this medication with benzodiazepine, and you want to educate the patient for consuming alcohol, because it will increase and depress central nervous system, and it can lead to coma. So it's not something, it's very risky. It's not something to be messed with. It increases QT-prolongation, as we mentioned, and that can lead to arrhythmia risks. Clinical borderless include it has a lower potency antipsychiatric and more sedation and hypotension. It has EBS risks, and it's lower than compared to Haldol, but it's not zero. Usually when sedation and antipsychotic, usually when a sedation plus antipsychotic medication is desirable, rarely first line today, it's not the first line today due to side effects affecting burden. Chronic use can lead to TD and risk remains. You want to educate the patient that this may cause sedation, dizziness, so you have to raise slowly, avoid alcohol, avoid the sun and photosensitivity. You want to use the sun cream, report muscle stiffness, fever, yellow skin or jaundice, abnormal movement. You want to educate the patient to report all these symptoms. It has also combination. So when you compare to other medication, it has low potential compared to ChlorproMAZINE or Haldol. So Haldol has a higher potency. This medication has a low potency. Haldol has a low sedation. This medication has higher sedation. It has also cholinergic effect. Haldol has high EBS. This medication has a lower. Haldol has a higher EBS, and this medication has a lower risk of EBS. Haldol has lower effect to lower the blood pressure, so it has a low orthostatic blood pressure, but this medication, Thorazine, has a higher risk of lowering the blood pressure. Thank you for joining me today. I would love to see you in my next video. Thank you.